So good afternoon, everyone.
Good afternoon.
Hello, my name is Bre'Ana Simone. I am a media personality. I have a media company and a talk show called After with Bre'Ana Simone, and it showcases positive things in the community as such. So if everyone can give it up for her best, that would be awesome. There's a lot of negative things going on, especially in our community, so I think this is a great event and definitely great things that need to be showcased, right? Positive things are always good to showcase. Awesome. So I want to welcome you to her best. So clap it up for yourselves for coming to this awesome event. All right. So I want to welcome you to her best 2016. We are so thrilled to have you on behalf of her best. We want to thank you all for coming, and we want to make sure that we acknowledge the Pink Fund. The Pink Fund is a non-profit organization that provides financial support to help meet basic needs, decrease stress levels, and allow breast cancer patients to focus on healing while improving survivorship outcomes, which is awesome. So we definitely want to make sure that we acknowledge the Pink Fund. A lot of the benefit for this event will go towards the Pink Fund, so again, we want to thank you for that. We're looking forward to our friendly conversation, and we want to make sure that we let you know that this is a place where you can be free. You can ask the questions that you've been dying to ask. We have some pretty great health professionals here, so we want to make sure that you ask any question that you feel. There's no such thing as a dumb question. I know you hear that all the time. But first, we have a musical performance, so clap it up for that. At this time, I want to bring Charity Ward to the stage. She is a Detroit singer and songwriter, and we want to welcome her and give her a warm welcome. Charity Ward, everyone.
Since it's just ladies today, I wanted to do some of the new stuff that I've been writing. The first song that I'm going to do is called Self-Love, and I wrote this sort of just in the thick of a breakup while I was kind of like sort of reprogramming some of my ideas on love, and kind of recognized that I had sort of crafted my life in this way where I felt like men were responsible for loving me, and that I had no responsibility to love myself. So I was kind of like pulling those layers back. I wrote this song sort of to myself. This is, I think, the first love song that I wrote to myself. It's called Self-Love. Say, I'm done waiting on Prince Charming to come in, save me. I'm still debating on why he's always misbehaving. But I forgot how much I mattered. My hands are bruised and battered from carving hearts in trees. Gotta pick up my sword, 'cause I'm my reward. And I am the remedy. I'm my own lover while I recover. I don't need your help. Love's got me so tight, and I just want my whole heart to myself. Well, I thought if I cleaned up, if I tidied up my stuff, if I could clear away the debris, my hero would look down into the lost and found, and he'd come and rescue me. Say, why didn't someone scold me? How come no one ever told me that I'm not incomplete? So I'm sitting down, I'm gonna straighten my crown, 'cause true love begins with me. I'm my own lover while I recover. I don't need your help. Love's got me so tight, and I I'll be your savior, I'll be your light. I'll treat you good, I'll hold you tight. I'll be your savior, I'll be your light. I'll treat you good, I'll hold you tight. I'll be your savior, I'll be your light. I'm my own lover while I recover. I don't need your help. Love's got me so tight, and I just want my whole heart to myself. This next one is called More Cake. Make sure I'm straight. More Cake is sort of about how when I got closer to my mid-20s, I realized this sort of pressure around women to be married, and how certain aspects of our society sort of validate our worth via marriage. And I even realized that I had this slick obsession with weddings, at least, whether it's watching Say Yes to the Dress or building my Pinterest board for this this wedding that probably won't happen anytime soon. We've picked our bridesmaids out before we even like a guy. We know our colors, and it's what? So this song I sort of wrote in rebellion to that, to say that there's more cake than wedding cake. I bet you know exactly what you're wearing and how you style your hair. The tuxedos on the boys, my God, they look so debonair. Something old, something new, something borrowed, something blue. Did you take some time to discover you? Sweetheart, neckline, solitaire stone, red velvet, buttercream, rose gold. You've been painting dreams in watercolor since 2002. Please save room for dessert, 'cause if they don't come true, there's more cake than wedding cake. There's more dreams than diamond rings. There's more you're here to change than your last name. There's more cake for you. There's more cake than wedding cake. There's more dreams than diamond rings. There's more to this beautiful life than being a beautiful wife. There's more cake for you. A baby doll, a kitchen set, a miniature vacuum. From her earliest memories, we've been telling her what to do, but her face will turn a shade of red and her world a deep cold blue. When the boy she planned her hypothetical marriage with don't want it too, so buy your daughters toy airplanes, then they'll want to see the world. Teach them there's more precious stones than diamonds and pearls. So if he walks away, if it don't work out, and her heart starts to hurt, tell her there's more love, more joy, more beauty in this wild, wide universe. And there's more cake than wedding cake. There's more dreams than diamond rings. There's more you're here to change than your last name. There's more cake for you. There's more cake than wedding cake. There's more dreams than diamond rings. There's more to this beautiful girls doing our thing, talking about our experience. So I wrote this based on the symbolic meanings of each color that resonated with me. So purple being the color of royalty, pink the color of sort of femininity, and gold as the color of blessings and healing. Just as a sort of encouragement to women like myself to sort of take pride in our experiences and everything that's broken us and healed us and sort of made us exactly who we are. So purple, pink, and gold goes like this.
give our health panelists a awesome round of applause as they make their way up to the stage. Awesome. These ladies are volunteering their time to answer our questions regarding breast cancer awareness and intimate health. So let's give them one more round of applause as they make their way to the stage. So we're going to ask if each of you can introduce yourself and then give us a little bit about your profession.
Bre'Ana.
Bre'Ana. Okay, I'm Dr. Roy. I'm a natural
chemotherapy, radiation, surgery, but also for young ladies like yourself to help you with cancer prevention. And when people finish treatment, to help them with survivorship, so lowering the risk of recurrence, keeping them well through nutrition, changes in lifestyle, changes in health behavior, and natural therapies that are safe, evidence-based, and cost-effective. I'm in private practice, but I work very closely with oncology in all hospital systems. Our patients are referred from Beaumont, Hanford, DMC, and I used to be with Beaumont Oncology Services, and before that, Cancer Treatment Center.
My name is Tracy Lewis, and I am a radiographer with a specialty in breast imaging at Hanford Health System. I've been there for 28 years. I am also the instructor for the mammography for the Wayne State School of Radiology there. I also have hosted several of these familiar types of events over the years. I've worked with a friend of mine who was a 17-year cancer survivor of breast cancer in an event called the Celebration of Life, and where we use that event to encourage women who have been newly diagnosed with the disease.
Hi, I'm Dr. Lisa Martin. I'm a professor here at U of M Dearborn. I have joint appointments in both women's and gender studies and health policy studies. And my background is in public health, specifically health behavior and health education. So I'm not a practitioner like everybody else on stage, but I take a larger public health view. But I can also, depending on the questions that come up, talk to you as a recent cancer survivor. So this look is not by choice. It was not breast cancer, but we can talk about it.
Any survivor.
Yeah, right.
Dr. Amy Ralston, one of the associates in gynecology residents at the University of Michigan. I did my master's training at the University of Michigan State on for OB/GYN training, so I take care of women across all of the lifespan, kind of through pregnancy, and then also training within the GYN oncology department to take care of women with gynecological cancers as well. So I'm in training still, but can give you kind of perspective from what we see and what I've been involved in so far.
Hello, my name is Patrice Lucas. I'm a licensed mental health counselor. I run a private practice called Indigo Transitions. And I like to say I work with everyone in the family system or in the community, and I really take it from the cradle to the grave. So I work with the new parents, the toddlers and the teens, and as you age, you go through the transitions of life, and I do everything from individual counseling, couples counseling, family, marriage, and organizations. I also run a social advocacy group called Coffee with a Counselor. And that's where I really use the biggest tenet of my work, where I say I meet my clients where they are. So I go into the community and I have those hard conversations about mental health. And I make them not so hard. The job I feel like I have in this world is to put a face to mental health and make it just as easy to talk about as we talk to our health practitioners about our physical health. Thank you.
You guys can hear me good, right?
Mm-hmm. Yeah.
Awesome. Okay, so we want to thank our health professionals for their time, and thank you for introducing yourself. So one more time, if we can give them a round of applause. Awesome. Well, let's jump right into the fun. So at this time, we're going to jump right into questions. Remember, no question is a dumb question. So ask on whatever you feel, whatever comes to mind. We also have some questions that if you didn't feel comfortable with sharing or asking, we have them that we were able to write down. So we can first start with our first question. Assistance so far as like ovarian cysts.
So ovarian cysts are very common. I'm going to pass this back to Amy. I'm going to pass it back to you just 1 second. Ovarian cysts are very common. They don't usually become cancer. Ovarian cancer doesn't typically happen when you're this young. It usually happens later in life. Ovarian cysts are more likely associated with things like polycystic ovarian syndrome, which is pretty much more common in younger ages and is associated with changes in how you use fat and sugar, metabolic disease. But if you have been diagnosed with ovarian cysts, it's not something to worry about in terms of cancer. But I'm going to let Amy pick it up from there if there's any questions.
I think you hit the highlights, but yes, usually it's very common to have cysts, and sometimes those cysts can come and go with your menstrual cycles as well. So ovulatory cysts are actually very common that we see. They can cause pain, they can be uncomfortable, they can rupture, things like that. But you're exactly right that usually most of the stage cysts are very, usually not associated with cancer and are very benign. There's a very rare, form that is sometimes called a borderline that can become malignant, but that's usually later in life and is usually not seen at this time. So if you've been told you have ovarian cysts, it's not something you have to worry about evolving into cancer. It's usually very common.
One more thing, though, Mariah, if you have been told that you have cysts and you tend to be a cyst producer, there's things you can do with your nutrition that can help to lower the frequency that you're having cysts, particularly if you're having painful ovulation or cyst that rupture, right? You can shift towards a plant-based diet, so what's called a phytoestrogen diet. Plants have estrogen modulators in them. Things like lentils, beans should be having in your diet at least 2 servings a day, lots of green leafy vegetables. Those things will help to modulate the way that you're using cholesterol, which is a backbone.
Talk to my doctor about it. It's always like, well, some women just are different, and sorry, but they're like debilitating cramps. So can you speak to if maybe there's something that I can do to prevent them, or if it could be a sign of something else that's wrong?
So unfortunately, menstrual cramps are pretty common. Something that we tell people is that you can start, if you have pretty regular cycles, you can start about 2 or 3 days before your cycle and start taking Motrin around the clock, scheduled kind of through your period. Motrin is the best thing for those cramps in terms of treating the symptoms when they happen. And that's really, what we usually tell people to do. Heating pads are also really good for that. It can also be a sign of things like endometriosis. So people that have endometriosis can have worse menstrual cramps. Unfortunately, the only way to definitively diagnose that is by taking a look and doing surgery. But sometimes people have, you will see that people that have really painful menstrual cramps often have a component of endometriosis as well. There's unfortunately, not enough time that you can do that, but to actually treat the cramps, you can do Motrin around the clock, kind of start 3 days before your typical your period.
And something, I don't know if we were going to talk about fibroids, that you might want to ask your doctor to check you for those, and they are common in a lot of African American women. As a matter of fact, the Governmental Women's Health Studies at Henry Ford Health System has started a program, and you can get paid for it to see what the cause of it is in many African American women. But if your periods are heavy, if you're clotting, it normally is associated with a lot of pain. So again, they can order a pelvic ultrasound on you, and they can find out early if that's the case, or if that's what's causing your pain.
Tracy. So I think those are 2 good points, right? So fibroids, which are benign tumors, they're not malignant, they're not cancer, but they happen in the uterine lining, sometimes in the muscle wall itself. Those can cause heavier periods and more painful periods. And then endometriosis is when the uterine tissue goes outside of the uterus. So maybe in different parts of the abdominal cavity. So when you cycle, that tissue, which has become kind of plump and cushy, also cycles out through the menstrual period, and that can cause painful periods. So those are 2 things to talk to your gynecologist or to your PCP about. But the other thing to consider is maybe talking to someone like myself or another board-certified natural medicine doctor. I say board-certified because natural medicine is kind of the Wild West in Michigan. It's not regulated. The federal government does not regulate natural therapies themselves, so source, contamination, dose is an issue. Anybody can call themselves holistic, integrated in Michigan. Anybody can call themselves a doctor. Those aren't regulated terms. So it's really important that you see someone who has actually gone to medical school and in addition been trained in natural therapies. But there's a lot of hormone modulators that are gentle and appropriate for you to take at your age. Things like Vitex or chasteberry or black cohosh are excellent for you. There's women's formulas, there's high quality women's formulas that are pharmaceutical grade that you can get, and take or teas that you can have made, but again, we have to worry about source, contamination, dose. So it really should be an integrated approach. I agree with the motion, and I agree with looking out for the more serious things, but also looking at lifestyle measures. And maybe Patrice, you can talk about this as well. You know, there's cultures where as we age and as we go through different parts of our life cycle, we don't tend to stigmatize and shame women, and so we have less PMS symptoms, less menopausal symptoms, so also some mind-body stuff.
Dr. Murray, exactly. I wanted to just bring that into the space, particularly when we talk about our menstrual cycles. From a very early age, many of us, we kind of gain this negative association with our menstrual cycle. Am I alone in that, or do we kind of start dreading it? That, you know, it's the ugly big fat monster in the room that comes every month, not flow, right? It's just this downer type of behavior and mentality we have around it. Yeah. Okay. And what I found is from a mental health perspective, with anything, how you think about it greatly impacts how it shows up and manifests itself in your life physically, right? So I started this practice on my own, and I started doing this for myself. I wanted to be more gentle with myself as it related to my menstrual cycle. I wanted to welcome it, celebrate it, you know, learn from it, and kind of go back to some of the more cultural, historical things that used to happen around women's intimate health and menstrual cycles, and become back in tune with that, right? So what happens is all these commercials on TV, this patriarchal society, ooh, I said it, really kind of tells us that we don't get to kind of just relax and be gentle and stay calm and quiet and maybe stay in the red tent or our own red homes during that time and really become in tune with ourselves. And I think that changes the outcomes as well, right? I'm teaching my 13-year-old daughter, she hasn't received her cycle yet, but I want it to be a celebratory thing. I don't want her to suffer the way that many of us have suffered because of some of the kind of negative connotations that we have associated with it, and the unrealistic expectations we put on ourselves around our cycle time, right? To continue to perform as if we're not losing large amounts of blood or, you know, having this huge, very purposeful biological process going on in our body, right? So it is a time to kind of keep quiet, settle down, eat the things, as Dr. Roy kind of mentioned, drink the things that is nourishing and nutritional and will help aid you in that space. Diet, exercise, and your mental health will really make a great difference. Even saying our mantra to yourself during that time. Okay.
One thing we talk a lot in my women's health classes about the social construction of illness, and so we talk a lot about how gender expectations shape our experiences, and especially around menstruation. So another thing that can be really helpful for women is by the time the cramps or something shows up, we've already put ourselves in this kind of negative expectations headspace. So actually keeping a journal or doing some tracking, and if you're not a journaler, there are apps that you can get for free too that let you kind of track with emojis or moods and things. But just don't set any expectations, but for 3 months, just record kind of how you're feeling the days before, the days after, and that can kind of then help train your mind. Once you kind of look at the data in a way, you can kind of learn what to expect and then think about ways that you might want to approach those times differently, or you start to see the patterns that are emerging for you. And they might be different at different points in your life too. And so it's always good to kind of check in with our bodies on a personal relationship, right? And make space for reflection in that time.
I agree with everything. This is great. And kind of as Dr. Orr was saying, some of the things that you can either take, I just wanted to add too that sometimes I've had patients that when their period isn't as predictable as other people, so when they are like, oh, it comes in 30 days and then 15 days, all, you know, I found that some patients are around and they're trying to better engage with their cycle and kind of adjust to it, that going on some sort of hormonal control can be helpful, and that can be helpful with the cramps as well. So birth control pills, things like that can help to time your cycles as you're starting to try to get your mind around how your relationship is going to be every month with that. And then it can also help with cramping and things like that. So it's just something you keep in the back of your mind, and if you need the contraceptive effects too. too is a good combination for people, so it's just something to keep in mind.
Great questions. Good question here, so.
Whoever first.
Who would your question first, ma'am? All right, no question?
I have a question about being overweight and obesity and it's linked to cancer, heart disease, diabetes. I'm trying to watch my food labels, I'm eating more vegetables than fruits, and I'm particularly trying to reduce the amount of sugar in my diet because I have a lot of diabetes in my family. What other advice can you give me on what's a healthy level of sugar in my daily diet?
What's your name, my friend?
What's my name? I'm Pat.
Hi, Pat.
Hi.
Is it easier for you guys without the mic?
Yes.
Okay. So, Pat, there was a lot in my question, so I'm going to start, and then I think we'll do just one person by person. In terms of risk factors, so I can't tell how old you are, and I'm not going to call you out.
Senior citizen.
You're a senior citizen. You may be at risk, so part of it is aging, right? Puts us at risk, right? There's an exposure over a lifetime. But you can still somewhat modify your risk, and you can still approach your life from a cancer fighting perspective. Some of the things you mentioned are important. Making changes in your diet, particularly as we talked about with Mariah and with Charity, moving towards a plant-based diet. So the research shows us that a diet heavy in fruits and vegetables, well-washed, aim for organic if you can afford it, and shifting your protein from meat towards fish, tofu, legumes, so lentils, beans, full-fat yogurts, pasture-raised eggs, those kinds of things will help to modify your risk as well. It's important to exercise. So 30 minutes a day, 5 days a week is what's been shown to be clinically effective in lowering your risk. It can be combined for those of you who are younger, so if you can't get those 30 minutes every day, an hour every other day is fine. But you want to aim for 150 minutes a day. I think that there are some supplements that you may have heard of that lower your risk, so things like curcumin, have you heard of that? Has anybody heard of turmeric?
Yeah.
So turmeric is a spice that makes mustard yellow or Indian curds yellow. Curcumin is an extract from that spice.
Curcumin?
Curcumin, C-U-R-C-U-M-I-N. If taken in high doses with food, can help to lower your risk. However, it is contaminated over the counter. So that when I tell you the two sources of the two companies that test for contaminants are Meriva, M-E-R-I-V-A from Thorne, and curcumazole from Pure NCAPS. So I'm just going to stick to my portion, and then I think everybody actually can add to this in terms of surveillance and what else we can do to lower risk of recurrence, or risk of occurrence.
Well, just like she said, the risk today the risks are being a woman and getting older. That's the risk. The previous risk for breast cancer was overweight, hormone usage, if you've never had any children, and that's a viable offspring. If you have a family history of breast cancer in your family, and also if you are had an early menstruation cycle, and all of those combined were the risk factors. But today, as she said, some cancers are, estrogen-based, some aren't. So, along with the weight gain, not just in women, but that's the weight gain in men is the highest factor, actually, in alcohol use for breast cancer in men. And they don't even talk about it as much as we do. So, sure, yes. Definitely you want to make sure that you do your self-breast exam. And if you still have a period, that's 7 to 10 days afterwards, because your breast can come, it can seem lumpy prior to that. Also, you definitely want to have your mammograms done. And still, we do not do any mammograms on any women under 30 years old. And of course, that is a cancer risk as well, because the breast tissue is different. And I did bring some information on dense breast tissue today. But it is all of that coupled. But this is great, the information that we're giving you. But of course, what she's saying, to take better care of yourself and ask you to pay attention to your own body. I always tell my students, get in the mirror and look at your body and see, how just, don't be ashamed to do that. Make sure everything is in its place. There's no dimples, bumps, or bruises, or anything like that. And just make sure that your body stays the same from time to time. And if there's any changes that occur, consult your healthcare professional immediately. A lot of patients that I get actually are in denial. And some of them, I've had patients already in 4th stage, and the breasts don't even look the same anymore. And they've already got to the denial factor, and by the time they saw any health care, it's too late. So you really just want to pay attention to your own body and what it's telling you. It'll tell you if something's wrong.
So in terms, we hear a lot in public health about obesity and obesity epidemics and things, and when we really start to unpack the data, what we really learn is that diet and exercise are what we're actually talking about. So physical activity and what we're eating and consuming is more important than the actual size of your body, right? It's more the inside health and kind of what we're doing to take care of ourselves. So things like eating more healthfully, not eating less processed foods, right? Not putting so many chemicals into our bodies from food sources. And that daily activity level. So even 30 minutes a day can sound scary for some people, right? Because it's moderate, your heart's supposed to actually be going. And so there's been some really great movement and exercise studies coming out in the last few years that show that at best you want to do that kind of concentrated 30 minutes, but if all you can do is move for 10 minutes in the morning and 10 at lunch and 10 at dinner, splitting it up is still going to be more beneficial than doing nothing, right? So really we're learning about the dangers of being sedentary for too long. So, for me, you can see I have my Fitbit tracker on. I finally got a tracker that tells me to move every hour, right, if I haven't done it already. And so just kind of finding ways to train and find movement into our days is becoming more and more important.
This is all great. I agree with everything that's been said. For gynecological cancers, when you hear about obesity and your risk for cancer, one of the big things that we talk about is the fact that adipose cells or fat cells convert androgens into estrogen. And so estrogen positive or estrogen cancers that respond to estrogen you're at more risk for those because of that conversion. So you have more estrogen floating around your body because of the conversion of fat cells. So those are endometrial cancers and some of the breast cancers. And so that's kind of the biggest thing from a pure medical kind of pathophysiologic way of understanding risk from that standpoint. That being said, kind of to what Dr. Harris was just saying, is that even just a 10% reduction in your weight has shown to be very, very beneficial in reducing risk and making just your overall health better. And so it's not about getting into a certain BMI or things like that, but actually just getting yourself into a catabolic state where you're losing weight. And a 10% weight reduction is extremely beneficial, both from a cancer risk reduction, but also just from risk of heart disease, stroke, diabetes, things like that. Just a 10% weight loss is extremely beneficial. So I think it's, take everything a day at a time, but your goal should be reduction in weight, but not getting to a certain weight or BMI. It's just, taking off some of that weight and getting yourself into a good physiological profile.
I would really just add to piggyback off of what really already was said was know your body, right? Know yourself, know your body. You know what feels good. You know what foods feel good to eat if you pay attention. We talked a little bit about tracking and journaling. And so just kind of paying attention, when you belly up to certain meals, what are the after effects for your body? Did it feel good? Did it make a big difference in your mood, in your health, in your creativity, etc.? So it's kind of relating those ideas to your nutrition and your health. Does this feel good? Does this sustain my functioning? Does this help me to meet my goals? Right? And if we just kind of start thinking about it from that perspective, in addition to, is it meeting my health goals? Is it aligning me with being healthy? Right? Is it reducing my outcomes as it is related to disease? But really, if we just take it back to, does it feel good walking around after I ate that meal or had that sugary sweet or didn't exercise, etc.? It's more palatable to us. It makes more sense. That's the lifestyle change that we want to see versus I'm doing this to not have a disease. the exercise and diet should be, because I want to, not only do I not want to have a disease, I just want to live really well and feel good in all my day-to-day activities, whether that's menstrual cramping or, even having a clear mind to kind of confront some of the stressors that comes up for us.
So, I know that,
Before we move on, you asked about sugar, and we didn't talk about stress. So I just want to mention that we don't talk a lot about stress as a risk factor, but the commonality behind cancer, cardiovascular disease, diabetes, which are the main biggies in this country, is inflammation. Inflammation has a lot of contributors, right? And stress is one of them that we kind of mentioned, we kind of fail to think about. So diet and exercise are helpful, and exercise also feeds back and helps to lower your stress level, right? But lowering stressors in general in your life, whether that's through guided visualization, meditation, exercise, social and spiritual, sexual intimacy, all of those things help to lower the levels of inflammation overall in your body. And that can, on a wholesale effect, help to lower your risk of disease overall. Does that make sense? Breath work is another. Did we answer your question, Pat?
Thanks.
okay, awesome. I know Lauren had a question. I just want to mention something because you talked a lot about nutrition. And so I wanted to kind of just ask, how do you feel in regards to like pill taking as far as like Tylenol or different things? I know just for me, openly, I was recently diagnosed with ulcerative colitis, and it's like a stomach digestive thing, and basically the doctor prescribed me pills to take every day, but I'm 23 and I kind of just felt like for me, I didn't want to take pills the rest of my life, and so someone mentioned like maybe just changing your diet, and so I wanted to see kind of how you felt about that, because you just talked about nutrition, and so that maybe would be something to help that.
So ulcerative colitis, Bre'Ana, is
Right.
great. Ulcerative colitis is an autoimmune disorder. Did they explain that to you? So it's where your immune system is attacking your own colon area, your own GI cells, and that causes inflammation. We just talked about inflammation. In that case, it's really important to work really closely with a gastroenterologist and not necessarily close your mind to medication, but maybe have more of an integrated approach to how you're approaching it. Right? Medication is just a tool in your toolbox. You don't want to throw away a tool because you don't like the idea of it. It's about reframing, as we talked about with nutrients, right? You want to use all of your toolbox. Right? If you're trying to build a house, you're going to be like, well, I hate the hammer. I'm going to keep the screwdriver because I feel emotionally attached to the screwdriver. Does that make sense
Yes.
to you? So I think actually at your age, being 23 and so young and so healthy and so beautiful, with a recent diagnosis of UC, it would be a mistake to just throw away one important tool that can not only lower your risk of progression of disease, but also lower your risk of getting colon cancer later in life because of the ulcerative colitis. Does that make sense? Because you're also at increased risk for colon cancer being black, right? Just being black in and of itself in this country is a risk factor for disease. So you have to be very careful and you have to be very deliberate in your approach. So I say work with a very good gastroenterologist, but also see, again, someone like myself. And our information is in your gift bags. I think all of our information is in your gift bags when you leave. So if you have trouble finding us, you can just look us up the app. But see someone like myself who can help partner with what the GI doctor is going to need to look at different ways of approaching inflammation. Diet is important, but there's also supplements that are very important, like vitamin D. So low vitamin D is an independent risk factor for not only some kinds of cancers, but also for some kinds of autoimmune diseases. Fish oil is important for you. So there's a lot of ways to approach and push to integrate perspective. Does that make sense to everybody? So you don't want to throw away one thing. All of us are up here because everything that each of us brings to the table is very important in not only preventing disease, but treating disease.
Well, that was just good what she said. Just get yourself a good, the gastroenterologist, that's great. I'm glad you brought that up, because you got that information from her. Anything that's going on with you, and you present it to the doctor, and it's not taken care of, then get yourself someone else. Get yourself somebody who's going to listen to what you're saying. Just like she said at the beginning, there's no terrible question, there's no bad question. But I've just learned in the healthcare field of people not speaking up for themselves. The doctors are not God. I'm just gonna say it, So you have to pay attention to what's going on with your health care. And so, just like she said, by her being young, she wants to live on. So just get yourself a good health care provider who can, maybe, get you with a good, doctor on the other end. And like I said, just pay attention to what's going on. And, Patrice said a lot of things about documenting. Because see, we don't do that anymore. We just live our life, and go on with things. And take care of our kids and husbands and stuff like that. But we don't take care of ourselves as women. And then we end up passing away for whatever reason. But I just, wanted to add that just, at your age, especially the age that you are, just take care of yourself. Make sure you take care of yourself.
And a good doctor is someone who listens to you, but also someone who educates you.
That's right.
So it's very, very important that you understand how your body works, what's going on with you, and how you can use all the tools that are available to you to fight disease. Yvonne?
Yes, great question. My question is concerning the pap smear. So I recently went to do my annual exam, and I was told that the pap smear isn't necessary to do every year now. I think it's every 3 years. So I was kind of surprised by that and taken back. So I just wanted to get why is that, and what are things, I guess, I'm used to going to the annual, so I don't know what are some signs that we need to go in for a pap smear or those types of questions.
Very good question. There's been a lot of confusion, I think, around this in the general public, and there's been a couple of recent changes with the pap smear screening guidelines, and I can kind of explain why that is. But number one, we don't recommend pap smears for anyone under the age of 21, regardless of sexual activity. So you shouldn't start screening until 21, unless you have a special situation like you're on immunosuppression or things like that. And then secondly, we've changed how often we're screening people. The theory behind that, or the reasoning behind that, is because almost the large majority of abnormal pap smears or cervical disease is HPV related. Most people that are sexually active are exposed to HPV at some point in their life, and usually young women, adolescents, and very early 20s clear the infection without any issue. What causes cervical cancer is long-standing HPV infection that people are unable to clear. And so what we found is that people ages 16 to 21-ish were having abnormal pap smears, having procedures done on their cervix that puts them at risk for cervical insufficiency that causes problems in pregnancy later on for undue reasons. So they were having all these procedures done for things that would either resolve on their own or were benign disease or not cancer. So that's number one. That's why we've changed the screening guidelines. The other thing is, similarly to the frequency that we're screening, we know that cervical cancer is, in general, usually there's a few exceptions, but most cervical cancer is very slow growing. So screening every year is actually not very beneficial. So if you have a normal pap smear, you can get it every 3 years from the ages of 20 to 30, and then once you become 30, you get a pap test with HPV screening, and if both of those are negative, the new guidelines are to do it every 5 years. There are some variations of that, most certainly if you're having symptoms, if you have post-coital bleeding, so if you have sex, if you have bleeding every time you have sex, if you're having weird bleeding in between your periods, if you're having pain that's new, anything like that, you should definitely go and have an exam done, and we can take a visual look under a microscope if we feel that that's necessary. But the guidelines are just based on the evolution of the disease and the fact that it's almost all HPV related, and most young adolescents clear that.
So we all talk a little bit about the rising costs of healthcare, right? And so this is one of our good examples where data actually led to policy change and recommendations that make providing healthcare less expensive. Now, what used to also be tied was that when we thought the screenings had to happen annually, they would tie that to renewing birth control a lot of time, frankly. So they thought young women want their birth control, so they'll come into the office once a year to get that prescription renewed, and we'll do their annual checks and pap screening then. So this is a way of really reducing healthcare costs. And we've also then, now things with the changes of the Affordable Care Act, these types of screenings are now covered and considered preventative medicine, right, that we don't have to pay out of pocket for, which is another big change.
It's womb wisdom. Womb wisdom. Have you read Womb Wisdom? Yes, Womb Wisdom. It really helped me revolutionize how I thought about my seat of power is what I call my room. And it really helped me to really get to a space where I was empowered in all the decisions I made about my room, including who I had sex with, how I had sex with that person, and what I did in preparation to have sex with that person. So when I say that preparation, because why are we taking contraceptives, ladies? Right? Really, why? I know it's in the prevention of pregnancy. Okay, ding, ding, ding. But why? Why are we choosing a pill versus some other alternative practices, whether that is abstinence or the use of a condom? Okay? So room wisdom really does help you celebrate and understand your seat of power, and really helps you to reclaim your health from that perspective. Okay? Because that's really what makes all of us in this room unique and special.
Any more questions?
Yes, I have one that I would like for you to cover what you think. I know it's important for us to know our bodies. That's the most important thing, to know your body itself. And with cancer, it does not always show up, or you may not know it. We've done a great job of getting out to check for lumps. What about the kind that don't show the lump? Can you elaborate? Because of the fact that technology is going on and a lot of things have happened. How do you think the innovations that are coming with technology are going to help uncover those situations whereas you might have a spot but you don't have a lump?
What's your name, my friend?
What's your name?
Your name.
Ramona.
Miss Ramona, are you talking about just breast cancer or all cancers?
Just breast cancer. Breast cancer can show up as a spot, but not
So
necessarily
you're
a
asking
lump.
about specifically surveillance for breast, early detection for breast. Is that what you're asking? Okay.
Well, really, let me tell you, when you get to the point of feeling a lump, I always tell people you don't want to get there. You don't want to feel anything. It is really your own surveillance, because most breast cancers are found by actually a husband or a lover or the patient themselves. The doctor doesn't find it. So it's again in knowing your history. Like if your mother is the primary, if she's ever had breast cancer, a lot of people don't know that they normally start those males at age 28. Even though, like I said, we don't do anybody under 30 because the breast tissue is a lot of time dense, and especially if they haven't had any children. But it really is that. It's your own breast self-exam. And you know what? The steps are online where you can, feel your breast and find out what are the good and what are the bad ones. And that's why, we suggest that you, do your breast exam 7 to 10 days after your menstrual cycle. But if you don't have one, that doesn't opt you out. You still need to check yourself. There's other things that you can look, dimpling of the skin. If there's a dimple in the breast area that you never have seen, if the nipple was once out and now it's retracting, if there's some fluid, normally if it's clear, bloody or brown, it could be a problem. It's knowing your body like that. If you've had pain in your breast and it comes and goes, that might not be a problem, but if it's always there, that might be one. And so even though the mammogram is as uncomfortable as it is, go get it taken care of. And the guidelines, even for that, they're trying to change that, saying that you don't have to get it at age 40. But I would strongly suggest that you do not go beyond the age of 40. As a matter of fact, I x-rayed radiographed so many women that were way under the 40-year mark that had cancer that I started my studies at age 35. So it really does help to take care of yourself. And not only that, if you have any discoloring of the skin, any bumps that you didn't notice before, any of that. And the only thing that I know is not really radiographical, either if it's by mammogram, ultrasound, MRI, or any of that, is inflammatory breast cancer. And that cannot be seen on a mammogram. But there are symptoms to it, and I just spoke of them, like the pain and everything. So, believe me, it really is our own responsibility to find out if something is going wrong. Because if there is something in there, it's going to show itself on the outside eventually. So it's about taking care of ourselves. And I can't say that enough. Because like I said, most of the cases that come through is somebody that has ignored a symptom and it was there all the time.
So we got past the, I just want to say really quickly, you might hear a difference though between what your doctor says and what Tracy's saying in terms of breast exam, self-exams. I think Amy's going to address that.
Yeah, so a couple things in terms of just clarifying the guidelines. So different physicians follow different guidelines because the USPSTF, which is like the Preventative Services Task Force, and then the American Cancer Guidelines, and then our American College of Obstetrics and Gynecology guidelines are all a little bit different for breast cancer right now. So it's kind of what Tracy's alluding to in terms of some people say start at 50, some people say start at 40. Currently, my recommendation and our college's recommendation is to start at 40 and get them yearly. And then there are some people that say once you get to 55, you can space it out to every other year. And that's because usually breast cancers that come in the younger age group are more aggressive. And that's why there's this guideline that you should get them every year. My mantra is that I just get them yearly on people because I think that that is right now what I think is best based on evidence that I know. That being said, there is supposed to be a large consensus meeting of these groups in January of 2017 to where they hopefully come up with a universal guideline so that we can all just follow the same guideline. So that's kind of information coming down the pipeline, hopefully, in the turn of the new year. As is also alluded to, if you have any family history of breast cancer or if you've been known a mutation for one of the breast cancer causing genes, so BRCA is one of the very common breast cancer mutations, and you should have different guidelines. And I would actually recommend being seen by a breast specialist and kind of breast group that can give you mammogram guidelines in terms of how often you should be screened and when you should start being screened. And then in addition to that, sometimes mammogram isn't the best for young breast tissue if you need to have earlier screening, and so as we've alluded to, we'll often recommend an MRI or ultrasound in those situations. And then the clinical breast exam and the self-breast exam, there's a lot of controversy about that as well. The current evidence that exists is that clinical breast exams and self-breast exams are actually not the most effective way to screen for breast cancer. And so it's just a plug to make sure you still get your mammogram. I think that it's reasonable that if you feel that you want to do a self-breast exam, most certainly we encourage people to do that. And again, it's kind of about change over time. So if you if you have kind of stable once a month that's been there forever, you've had a physician check it out, or if you've had a mammogram, then that's, breasts have, variation to them, and that's normal. But it's really about kind of just monitoring yourself over time and making sure things aren't changing or that there's something new that pops up. And so that's the biggest thing. But there's a lot of controversy about the evidence behind clinical and self-breast exams in terms of how effective they are to screen for breast cancer.
And to add on to that, so there's no new technology, there's no magic, Superman vision or Superwoman vision that's going to tell you or detect a tumor or a lesion that much earlier than what we have with mammograms, MRI, and ultrasound. But there is a lot you can do with prevention, right? So we talked a little bit about diet, we talked a little bit about exercise, we talked a little bit about stress reduction, but also making sure you have good control of fat and sugar, so the metabolic health is very important. So making sure that you're checking with your doctor and making sure that your HbA1c is normal, that's a sensitive test for sugar, that your cholesterol looks good, and that you are overall maintaining good metabolic health. We now know that cancer grows in a terrain that's metabolically rich, so it's best to have good metabolic control if we're trying to control our risk of cancer.
And I just wanted to add, just to kind of piggyback off what the doctor said, because you're not going to get a MAM if you're under 30. There's no place that's going to do it unless you have a symptom. And the guidelines before was at the age of 40, if you did not have any family history or signs or symptoms, then they would do that initial mammogram, and then they would order it every 2 years. And again, it depends on what facility that you use. And then after 50, it was every year because you were getting older. But the thing about the breast self-exam, the reason they have so much controversy about it is because nobody knows how to do it. So it is a way to find out how to properly do that. And I don't negate that, especially for any lady under 30, because you're not going to have a mammogram done. So you want to make sure, like I said, that you check your own self and just make sure that, like I said, your body is the same as it was, unless you're gaining weight and everything like that. But of course, over a period of time, that's going to happen as well. And they do, the only screening technique is mammography. You cannot use ultrasound for it, and you cannot use mammography for it. But as you use these things combined, we normally combine the techniques, you know, as far as breast care is concerned. We don't use one over the other, because of course MRI is going to cost you a lot of money. And I'm just saying, you know, this is what is happening now. And the only thing that's new is the breast tomosynthesis. That's the information I brought today about the 3D breast imaging for any woman that has 50% or more dense breast tissue. And for years, doctors have not been able to see through that tissue. If you've ever had any children, if you are small, sometimes as you get heavier, your breast gets more fatty. Those breasts are easier to read, but this new breast tomosynthesis has broken ground in finding a lot of cancers that they have missed before in women with dense breast tissue.
All right, well, at this time, I think we are going to conclude our health panel. So can we give our health panelists an awesome round of applause for their questions? You can self-round of applause for their questions. If there are questions that you still have or you feel like you didn't get to ask, as they said, their information is in your gift bag, so make sure that you give them an email or a call if you have any questions that you may want to further discuss, or if you want their information. So let's give them another round of applause.